Hello, everyone, and thank you for joining us for session one of the six-part Family Caregiver Education session brought to you by the Alzheimer's Society of Nova Scotia. My name is Kara Murgatroyd, and I'm the Education and Support Services Coordinator for the Halifax region. The content of this session could bring up some questions and possibly some emotions that may be new to you. If you feel the need to reach out for support, please call our info line phone number, which will be provided at the end of each session. This session will look specifically at an overview of dementia. I'd like to acknowledge that we are on sacred land that has been the site of human activity since time immemorial. We are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people, and we acknowledge them as the past, present, and future caretakers of this land. So our objectives this evening is really to gain a basic understanding of Alzheimer's disease and other dementias, other causes of dementia. We'll also discuss some of the symptoms of dementia and the effects that it has on the person's daily life. We'll also look at risk factors for dementia, and we'll finish up by looking at briefly some of the resources and some of the programs that are offered at the Alzheimer's Society of Nova Scotia. So the Alzheimer's Society of Nova Scotia is a volunteer-based, not-for-profit health charity that was founded back in 1983. And so the mission of the Alzheimer's Society of Nova Scotia, the society is committed to alleviating the personal and social consequences of Alzheimer's disease and other dementias, and to promote the search for causes, cures, and treatments. So when we think about dementia, sometimes we think about, automatically our mind goes to memory. So we all forget things. We may experience changes in our mood or mix up words from time to time. But when this begins to affect our day-to-day functioning, it could be a sign of dementia, a condition called dementia. So what is dementia exactly? So dementia is really an umbrella term that describes a set of symptoms that may include memory loss, changes in judgment and reasoning, changes in mood and behavior, and changes in a person's ability to communicate. So communication abilities. People will have difficulty with thinking, problem solving, and language. While these changes may seem small at the start, they can affect the day-to-day lives of people with dementia. Dementia can impact a person's daily functioning at work, it could be in social relationships, or in everyday activities. So dementia is caused when the brain is damaged by diseases or a series of strokes. And so there are many diseases which can cause dementia, with Alzheimer's disease being the most common. There are actually over 70 to 90 different diseases or conditions that can cause dementia. We'll look at Alzheimer's disease first, then we'll briefly look at some of the other causes of dementia. Alzheimer's disease is the most common cause of dementia. So what is Alzheimer's disease? So Alzheimer's disease is progressive, degenerative, and it's irreversible. So once the changes begin, there's nothing that we can do to prevent those changes from occurring. There isn't a known cause or cure, and the damage that is done to the brain currently, it can't be repaired. Some of the brain cells within the brain, they shrink or disappear, and there's these proteins, these deposits, amyloid, which form plaques and tangles in between the cells, which makes it increasingly more difficult for the brain to do its work, for those messages to get through. The important thing to know about Alzheimer's disease and other types of dementia are that it's not a normal part of aging. So the key points to remember are Alzheimer's disease and other dementias are progressive. So the symptoms worsen over time. So that's basically what progression means. The symptoms will worsen over time. And there's different parts of the brain which will become diseased as the disease progresses. So the brain of a person with dementia has physical changes. These changes affect the person's ability to function. So the damage to the brain, it increases over time. And the cause of the disease, or the course, I should say, of the disease can range anywhere from a few years to 15 to 20 years. Usually on average, we say about 8 years. Alzheimer's disease and other dementias are sometimes referred to as the family disease. And what we mean by that, it's because as the disease progresses, the person actually becomes increasingly more dependent at times on others for the physical, emotional, and social support. So the roles and responsibilities of family caregivers are constantly changing as families adapt their care to the support that the person with dementia requires. So overall, know that Alzheimer's disease is a specific disease, while dementia is a general term for a group of similar diseases, of which Alzheimer's is one. In other words, every case of Alzheimer's disease is an example of dementia, but not every type of dementia is Alzheimer's. So the person with the disease can't change, and that's something that we need to understand. Others need to adapt their communication and supports in ways that assist the individual. So we often suggest that the goal is to offer support so that the person with dementia can continue to be as independent as possible while offering the right amount of assistance to reduce the frustration that sometimes the person with dementia may feel. So we'll see a short video clip next. And what this video clip will share with you is it will help you to understand the difference between dementia and Alzheimer's disease.
Just what is the difference between Alzheimer's disease and dementia? Technically speaking, dementia is actually an umbrella term for a set of symptoms that's caused by progressive and irreversible brain diseases. Alzheimer's is the most common cause of dementia. Other common causes are vascular disease, Lewy body disease, and frontal temporal dementia. The key thing to remember is that a person with Alzheimer's has dementia, but only some people with dementia have Alzheimer's. Symptoms of dementia can be hard to define and can vary from person to person. You may expect things like difficulties with remembering, thinking, and language, difficulties with daily activities, and emotional or behavioural difficulties. In the case of Alzheimer's, the symptoms are a little more specific. At first, a person may appear to have mild memory problems and even a change in behaviour. But as time goes on, these symptoms tend to get worse, and other symptoms such as confusion or depression can appear. What about treatment options? Can dementia be reversed? Sadly, dementia worsens over time and can't be reversed or cured. When Alzheimer's is the cause, there are medicines that in some cases may slow down the development of symptoms for up to 2 years to help people manage daily life independently for as long as possible. While symptoms will worsen over time, until around-the-clock care is needed, people can live well with dementia if they receive support, good care, and understanding. We all want to know if we're at risk, or what measures we could take to prevent dementia. Though we might be more at risk in later life, rest easy, knowing it's not an inevitable part of getting old. Having a healthy lifestyle, looking after your diet, getting enough exercise, and not smoking can help reduce your risk. Dementia can have a huge impact on family and those looking after loved ones. So if you're a carer, make sure you reach out for support.
Okay, so as mentioned in the video that we just watched, dementia is really an umbrella term. So it's used to describe a range of symptoms associated with cognitive impairment. As I said earlier, there are over 70 to 90 different types or different causes of dementia. So Alzheimer's disease is the most common cause of dementia and accounts for about 50 to 60% of the cases of dementias. Vascular dementia reports about 17 to 30% of the cases and is the second cause of dementia. And then we'll look at vascular dementia. So vascular dementia is the second highest cause of dementia, followed by Lewy body and of course frontotemporal lobe dementia. Vascular dementia is a type of dementia caused by damage to the brain from lack of blood flow or from bleeding in the brain. So for our brain to function properly, it needs a constant supply of blood through a network of blood vessels called the brain vascular system. So when the blood vessels are blocked or when they bleed, oxygen and nutrients are prevented from reaching the cells in the brain. So as a result, the affected cells can die. And so when these brain cells die from lack of blood flow or from bleeding, then strokes can result. It's important to note that not everybody who experiences a stroke will go on to develop vascular dementia. Vascular dementia can be a consequence of a stroke. So stroke symptoms may affect a person's ability to walk. There may be a bit of weakness in an arm or leg, slurred speech, and trouble learning new tasks. With Lewy body dementia or Lewy body disease, it's a form of dementia characterized by abnormal deposits of protein that form inside the brain, some of the brain's nerve cells. So these deposits are called Lewy bodies, named after the scientist who first described them. So areas of the brain that involve thinking and movement are most affected in Lewy body dementia. Hallucinations are hallmark characteristics for Lewy body disease, or sometimes known as LBD, Lewy body disease. So frontotemporal lobe dementia, which includes Pick's disease, another name which you may hear of is Pick's disease. Unlike Alzheimer's disease, it really affects specific areas of the brain, so the frontal and the temporal lobe. So that's the frontal cortex. So the early symptoms may actually be in changes in personality and behavior and or speech, language. So the frontal and the temporal lobes of the brain are the areas generally associated with personality, behavior, emotions, language, speech, abstract thinking, and movement. So it wouldn't be uncommon or unexpected, say, for a person who has frontotemporal lobe dementia to begin to say and do things or act differently, maybe inappropriately. So something that's not necessarily the norm for that individual. It's because that's the part of the brain which controls a person's personality and behavior. And so their ability to regulate sort of that behavior or that personality, the mood, it's impaired because that's part of the brain that's diseased. So now we're going to go to discuss the symptoms specifically associated with dementia. Okay, so no matter if it's Alzheimer's disease or one of the other types of dementia, there are a number of common symptoms that a person experiences. So it's important to realize that not all individuals will have all the symptoms, or that each individual will have the same difficulties with the symptoms. So basically, it's each person with dementia is unique. They're individual. They all have their own strengths. They have their own challenges. They have their own personalities, and they have coping styles and different supports as well. So all of these things play an important role in how a person will journey through the disease and how they experience the disease. So what we're going to talk about next are some of the most common symptoms of dementia. So the memory loss actually is usually the first. I think usually when people call the info line at the Alzheimer's Society, it's memory loss that people are concerned about. So as we see this woman here in the image, it's an infographic. Actually, this is a great infographic. You can call the info or the Alzheimer's Society, and we can send you out this infographic. It has all of the 10 symptoms on it. So memory loss is the first symptom. And so memory loss that affects day-to-day abilities, forgetting things often or struggling to retain new information. So we see this woman here, she's standing in front of the calendar and she's really struggling to remember the information or remember that doctor's appointment or remember that, that lunch date with her friend. Using cues like a calendar can be quite helpful in the earlier part of the disease. So again, memory loss that affects day-to-day abilities. We're going to take a short break now, actually, and after the break, we will continue on with the remaining symptoms. Okay, so one of the second symptoms associated with dementia is difficulty performing familiar tasks. So it's forgetting how to do something, and it could be something that you've been doing your whole life. It could be something such as preparing a meal or getting dressed. So we see this individual, we see this gentleman here, And, he's maybe making breakfast, or maybe it's a late lunch, and he's frying up some eggs. Maybe he wanted to have scrambled eggs. The part of the puzzle here that's missing, though, is the fact that he forgot to deshell those eggs. So it's those specific things in our day-to-day tasks that become increasingly more difficult. So another example of that would be, like for us, for instance, we may get so distracted from time to time that, if we're preparing a meal, we may leave the carrots on the stove and only remember to serve them at the end of the meal. For a person who has a type of dementia, they may have trouble with the task that they've been doing their entire life. So it could be, preparing, like it could be peeling the potatoes, it could be peeling the carrots. So those are the things that become increasingly more difficult for people with dementia, those familiar tasks. Okay, so problems with language. And so problems with language and communication. So everyone has trouble finding the right word sometimes. But for a person with Alzheimer's disease or another type of dementia, they may forget simple words, or they may use the wrong word. So it's the wrong word is used in a different context. So this makes it harder for us to understand exactly what it is that they may need or require. So forgetting words or substituting words that don't fit the context. So sometimes you may need to use your detective skills to try and understand exactly what they're trying to say. So for instance, we see this woman, she has, she's got a pet in her hand, she's raising the cat. She knows it's a pet, but for her, she's really struggling to find the right word. It's either dog or cat. So we're not 100% certain what it is that she's going to choose. But if we know this individual and she has a cat, and if she says, I have to let the dog outside, we're going to know specifically, okay, she used the wrong word. She has that similar word, but she's having problems with language. And so she says dog instead of cat. Okay, so disorientation in time and place. So sometimes it's for us, it's normal. We may forget what day of the week it is, or we may be on the highway driving somewhere. We may get distracted because we're thinking about the thing we have to do when we get to our target destination. But we will, get back to remembering exactly what it was. But a person with Alzheimer's disease, they may become lost on their own street. So they may not know how they can get back to that destination. So for this gentleman here, we see, there's that disorientation in time and space. And so not knowing what day of the week it is, or getting lost in a familiar space. So this gentleman, he may be in his apartment building and he may be on his floor, but there may be a few corners on his floor. So there may be a few different levels. And it may be really difficult for him to try to figure out, do I go left? Do I go right? Do I turn around? How do I get back to my home? He could be out in the community. He could be the type of individual who loves to go out and go for a walk. Exercise may be the thing that really gives him purpose, but gives him energy and helps with his mood. And if that's the case, that exercise is going to be very meaningful to him. So it's to try to figure out if we notice that, let's just say this gentleman is going out for a walk, and normally it takes him an hour to go for his walk and return back home. And then all of a sudden, it's an hour and a half and he hasn't returned home. I'm going to start, getting worried if this is my dad or if this is my partner who's gone for a walk and hasn't returned within that sort of amount of time. And so if that's the case, it's really at a point we want to ensure that he maintains his exercise, because that will, improve his mood, but also help him to live longer in the earlier stage of the disease, that exercise. I'm going to, talk with the family and talk to him to find out exactly what we can do to ensure that he's exercising, but exercising safely. So it could be connecting with, Medical Alert Safely Home, which is basically a medical alert bracelet, which will say on the bracelet that the person has a medical condition which causes problems with memory. And so if I happen to be a good Samaritan and I'm out in the community and I run into him, I can stop and I can see on the medical alert bracelet that there's an emergency contact number there. And that emergency contact number will give me the name of his family so that I can find out where he lives. I can get their contact number and say that Bob is at the corner of Roby and Windsor Street. All right, so just to get him back home again. So again, it's that disorientation in time and in space. And sometimes a person may become disoriented in what year it is. So, they may look at themselves in the mirror even, and they may think that they're 30 years old when in fact they're about 70 years of age. So there is that disorientation of time and place, something to be aware of. Okay, so with impaired judgment, so what's happening here in this image is, this individual here, she's waiting for the bus. So with impaired judgment, it's not recognizing a medical problem that needs attention. Or, for instance, it's wearing light clothing on a cold day, as this lady is here. So she's clearly waiting for Metro Transit. But because her reasoning is impaired, she doesn't realize that she requires, maybe wearing a toque, some gloves, a heavy coat, because the weather has changed. And so it's that impaired judgment and reasoning which can really be a significant change for the person. Another example of this may be, for us, we may realize that, we might have a bit of a cough. It may move into our chest. And then when it starts getting into our chest, we think, oh, maybe I need to go see the doctor. Like I may need a prescription. I may require an antibiotic to sort of clear up this congestion in my chest. For people with dementia, they may not recognize that there is a problem. And so it may be later on in whatever it is, whatever virus that they might have. So they may not go to the doctor right away. So really important to be aware that, a person will have decreased judgment and decreased reasoning as well, which can affect their abilities. Problems with abstract thinking. So having difficulty balancing a checkbook, for example, or maybe it's not understanding what the numbers are representing or how they're used in the checkbook. So we see this gentleman here, he's sitting down. It looks like he's probably doing his taxes, which is coming up soon for those of you, depending upon when you watch this, I guess. So it becomes increasingly more difficult to make or to do small calculations. So this gentleman is really struggling to to try to figure out those additions. The other example of this that I could give is you may be at a grocery store and you're with your family member with dementia. The cashier, they're going through and they're paying for their groceries, and the cashier may say, okay, that's $50. And your family member may hand over two $20 bills. So it's the ability to make those small calculations. It becomes increasingly more difficult. And also speaking on the phone at this point in time too, like it's that abstractness, not having those visual cues. So when you're talking on the telephone, this might be really difficult for your family member with dementia because they're not receiving, the nonverbal communication, the facial expressions that we normally would rely on when we're looking for cues and information, especially because, if we're now having difficulty in comprehension, being able to read another person's facial expression can give us a lot of cues as to what's happening in that conversation. So problems with abstract thinking is yet another of those symptoms. Misplacing things. So that's putting things in peculiar areas, strange places. So for instance, this lady, she's putting her dress in the refrigerator, or could be, taking her wristwatch and maybe it's putting it in the sugar bowl. So it's maybe, for us, maybe we temporarily misplace our car keys, or it's the remote control, or maybe it's our wallet. We can retrace and figure out, okay, what did I do when I came home? Where did I put the car keys? Oh, they're on the ledge beside the door. But for people with dementia, it becomes increasingly more difficult to retrace their steps. And because they put it in a peculiar area, it's not an area that you're normally going to look in necessarily, especially if it's a wallet. They're going to put it in a safe place. So not surprising to see that maybe in a linen closet, it may be hidden in under the tea towels or the face cloths, that sort of thing. And one of the things that I always say, to be aware of, as a family member caring for somebody who's misplacing these items, it's not uncommon for you to become, for that person to become suspicious of you. Logically, if you're the only person that they see 24 hours 7, logically, if I misplaced something, if I put it somewhere, then you must have taken it. So for us, when we're caring for a person, it's important not to take that personally. And we may, and it's okay if we take it personally, but to know that if they were healthy, they wouldn't be pointing the finger at you. There are changes that are happening in this individual's brain, which is, causing a change in their ability to remember things and to put things in areas and to recall that information again. It becomes more difficult. So something to think about as far as those changes or those symptoms which occur because of dementia. Changes in mood and behavior. So people can become sad, or they may become moody from time to time. But a person with dementia, they may have fast mood swings. So for this gentleman here, he may run the entire gamut of just being sort of, sort of neutral, and then becoming sad, then becoming excited, then becoming angry. So there's that exhibiting of severe mood swings. And it could be within, a fairly quick period of time. There may not necessarily be a trigger for that change in mood or that change in behavior. Changes in personality. So behaving out of character, such as becoming confused or suspicious or fearful. So people's personalities can change somewhat with age, but a person with dementia, they can become more suspicious or more withdrawn. So some of those changes may include apathy, they may include fearfulness, or, it's sort of that acting out of character. The aunt or the uncle that we have that was always fairly, you know, happy-go-lucky, all of a sudden, there can be that quick change where they may become frustrated quite quickly. And that frustration, it could be because also that, they recognize that there is a change in their abilities. But there's a definite, for some folks, there may be a change in personality. And so finally, there is that loss of initiative. So it's losing interest in friends, losing interest in family, and some of those favorite activities that the person normally would love to do. And I always say for this one, that lack of initiative, I think it's really important to be aware of that. As human beings, we need connection. We need to continue to stay engaged in family, in community, with our friends. And if we lose, because of the disease, that part of the brain that controls our ability to initiate activities, initiate fun, initiate hobbies, if we're not aware of that as family members, when we ask, Bob, if he wants to do something, he says no. It's not necessarily because he doesn't want to do it. Sometimes it's easier to say no than it is to say yes, especially if you're given a number of choices for a person with dementia. Simplifying things when we ask questions can be really, really key. But knowing that there is that lack of initiative, important for us to continue to cue and engage our family members in a variety of different activities. At some point, they may have a difficult time in expressing to you that they might want to do something. So you have an advantage. You know your family member best. You know what their likes are. You know what their dislikes are. So the key is to initiate activities that they love and those activities that they enjoy doing. Okay, so in our next section, we'll actually discuss some risk factors which are associated with dementia. Okay, so what are risk factors? I think that's probably one of the first questions to ask. So risk factors are aspects of your lifestyle, your environment, or your genetic background that increases the likelihood of getting a disease. So risk factors on their own are not causes of a disease. Rather, risk factors represent an increased chance, but not a certainty, that dementia will develop. So similarly, having little or no exposure to risk factors does not necessarily protect a person from developing dementia. So age is, when we think about risk factors for dementia, dementia is not a normal part of aging. However, we do know that age is the strongest known risk factor for dementia. So the older you become, the higher at risk you are. So approximately 1 in 20 Canadians over the age of 65 has Alzheimer's disease. After 65, the risk of developing Alzheimer's disease doubles approximately every 5 years, with 1 in 4 Canadians over 85 having Alzheimer's disease. While rare, dementia can affect people under 65. This is known as young onset dementia. So then looking at the family history and genetics, we don't yet fully understand the role of genes in the development of dementia. But we do know that most cases of Alzheimer's disease occur in people over the age of 65, which is referred to as the sporadic form of Alzheimer's disease. So meaning that it doesn't necessarily run in families. Only rare instances of Alzheimer's disease are inherited or familial. So people with familial Alzheimer's disease, they have a directly inherited type of the disease. So the children of a person with familial have 50% chance of inheriting the disease, which often strikes persons in their 40s or even in their 30s. So it could be their 50s, 40s, or 30s. So young onset is a term that we describe for people who are diagnosed under the age of 65. So again, this type of Alzheimer's disease accounts for only about 1% of the general population, or 1% or less of all the different Alzheimer cases. So being female, so sex actually, females have a higher risk of developing Alzheimer's disease than males. So while the reasons for this were still unclear, some of the potential contributors include females females live longer on average, I should say, than males, and changes in estrogen levels are still being looked at. So such changes in estrogen levels over a female's lifetime. So there's research that's being done there. We also look, though, at the presence of frailty and other health conditions, which tend to be higher among women. So for types of dementia other than Alzheimer's disease, men and women have the same risk. So mild cognitive impairment, people living with mild cognitive impairment, commonly referred to as MCI, you see the acronym there, they may have problems with their memory and language, thinking, or judgment. That the changes are greater than the cognitive changes associated with normal aging. So as its name implies, the problems that are experienced are considered mild. So they're not as severe as the symptoms experienced by a person living with dementia. So the cognitive changes associated with MCI, mild cognitive impairment, are usually not serious enough to interfere with the person's day-to-day activities or their independence. So MCI, though, may increase your risk of developing Alzheimer's disease or another dementia. Down syndrome. So for people who have Down syndrome, when they're in about mid-age, the middle age, many people with Down syndrome develop young onset Alzheimer's disease. And one of the symptoms of dementia, or one of the symptoms for Alzheimer's disease, is experiencing seizures for the first time. So this is a symptom which is different from the general population. So heart disease, risks, and diabetes. So heart disease and diabetes. So anything that affects your vascular system will increase your risk of dementia. Type 2, specifically type 2 adult diabetes, is a risk factor. And researchers, they're still investigating exactly what the link is there. We have previous head injury here, so especially repeated concussions may lead to a form of dementia, perhaps increase the risk for AD. And of course, that's Alzheimer's disease. So when we think about head injuries, the importance of really being aware of the safety and protecting our head when we're out, whether it's playing sports, when we're in our car, wear your seatbelt, those sorts of things. Really paying attention to safety as well, so that we can prevent those head injuries from happening and preventing falls from happening. So in the next section, we're actually going to look at risk factors that are non-modifiable and risk factors that are modifiable. Before we do that, we are going to take a few minute break, and we will return with those non-modifiable and modifiable risk factors. Next, we'll distinguish between risk factors which are non-modifiable, so those are in the red, that we see in the red bubbles, and those factors which are modifiable, the ones that we see in the yellow. So to reiterate again, a risk factor is not a cause of a disease. Rather, risk factors represent an increased chance, but not a certainty that dementia will develop. Okay, so we'll begin by looking at the non-modifiable risk factors outlined in the red bubbles. So these are factors we cannot change, which include things like our age, sex, genetics, or ethnicity. So age, um, of course, is the greatest, is the most common risk factor, and dementia is not a normal part of aging, but age is the strongest known risk factor for dementia. The older you become, the higher the risk. And so we look at African ancestry, and African indigenous people may have a higher risk of Alzheimer's disease due to the higher incidence of diabetes and higher cholesterol. So for people of African ancestry, um, are 2 to 3 times more likely to develop Alzheimer's disease. So there's about a 44% risk of dementia amongst first degree relatives for people of African descent. And when we look at sex, and that's of course being biologically female increases the risk of Alzheimer's disease. Females are twice as likely to develop Alzheimer's disease than their male counterparts. So, as far as a reason for that, yes, we live longer. And again, as I said earlier, they're looking at the role of estrogen and the changes that occur as women age. So the research reflects that when we think about the research reflects the sex assigned at birth as a non-modifiable risk factor. So there's more research to be done around how gender-affirming hormones and surgeries might or might not have an impact on dementia risk factors. So looking at genetics and family history, the majority of cases of Alzheimer's disease in people over the age of 65 are of the sporadic or late onset form. So we're really unclear about the causes of this form of Alzheimer's disease. While there's a 3 times greater risk for developing Alzheimer's disease if you have a family member with the disease, it's not directly inherited. So this type of Alzheimer's disease probably accounts for about 99% or more of all types of Alzheimer's disease. On the other hand, people with the familial type of Alzheimer's disease have a directly inherited type of the disease, and so their children have a 50% chance of inheriting the disease, which often strikes people under the age of 50, so in their 40s or 30s. And again, that's referred to as young onset, and again, fairly rare, affecting about 1% or less of all cases of Alzheimer's disease. So there are, as we just discussed, these red bubbles, which are non-modifiable risk factors. There are some things that we can do to try to, reduce that risk. And so this is what we're going to talk about, these sort of red bubbles, or sorry, yellow bubbles in front of me here. And of course, these modifiable, what we mean by modifiable is that they can be changed. They're things that we can do. So it's been estimated that around 40% of dementia cases may be the result of modifiable risk factors. So when we look at the first one here, I'm actually going clockwise. So we're looking at inactive lifestyle. So a sedentary lifestyle can definitely increase the risk. So really important to exercise, to get out, do activities that get the blood flow, the oxygen to the brain, really, really key here. Looking at high blood pressure, so looking at cardiovascular conditions that predispose you to vascular dementia. So people who have consistent high blood pressure or hypertension in their midlife, age 45 to 65, are more likely to develop dementia compared to those with normal blood pressure. So high cholesterol levels in the blood as well can increase our risk of dementia, as well as type 2 diabetes. So having diabetes may increase your risk of dementia, especially if it's poorly controlled. Smoking, again, we do know that people who smoke, their risk increases by 45%. And then, of course, obesity, but specifically obesity in midlife, so that would be between the ages of 45 to 65, can run the risk of increasing that susceptibility to dementia. So it's the obesity and lack of activity which can increase the risk. Also, another risk that's not here is heavy alcohol intake as well. So if you drink large amounts of alcohol, you may run a higher risk of getting dementia. So having one of or a combination of these risk factors makes you more likely to develop dementia. So it doesn't mean that you have dementia. So something to bear in mind, you may have all of these risk factors and may not get dementia. However, you may exercise and eat well and do a variety of different things, but you may, at some point um, be diagnosed with dementia. Again, it's sort of awareness and understanding and becoming educated about dementia and what those risk factors are and what are some of the things that we can do to reduce that risk. Okay, so next up, we'll look at getting a diagnosis. So what is involved in the process and why is it important to get an early diagnosis? Okay. So getting a diagnosis of Alzheimer's disease or another dementia can involve a number of assessments. So early diagnosis, why is it important? It can help rule out other possible causes of symptoms, which may be reversible, such as depression. It could be urinary tract infection, which is contributing to the symptoms that a person is experiencing. It could be stress. It could be starting new medications. It could be dehydration or poor nutrition. So there are a number of other reasons as to why a person may be exhibiting symptoms. So the other reason why it's important to sort of, get that assessment is because we know if we do have it, it's important to get proper care, treatment, and support early. The other thing is, preparing for the future, another reason to get that diagnosis. And then finally, when we think about, why is it important to get a diagnosis early, it's to provide a baseline as well for the person's condition so that if you go back in to see your doctor in 6 months or a year, let's just say, if you're doing well, then they'll have a baseline. So it's important. That's, there's various reasons as to why that early diagnosis is important. So diagnosis of probable Alzheimer's disease is accurate 80 to 90% of the time. The diagnosis can be made in a family doctor's office. It could be in a memory clinic, in a hospital, or in the community setting. So not all people undergo all of these tests. Some cases are very straightforward. However, some may need more diagnostic procedures. So people shouldn't feel that they've missed out on something if all of these tests have not been ordered or performed. So when we think about what those assessment tools, or what it might include, so there's that medical history. And so what they're really looking at there is how the person's symptoms have changed over time. The physical exam will help rule out other causes. And as far as lab tests, they may do some things like blood tests to help detect problems such as anemia, diabetes, thyroid problems, or infections that may be contributing to those symptoms. And there may be some other diagnostic tests involved. But again, that's fairly rare that other diagnostic tests are involved. As far as cognitive tests, so the mini mental state exam, so this part of the process really tests the person's sense of time and place, as well as the ability to remember. So the ability to express themselves and to do simple calculations. It may involve exercises such as recalling words or objects and or drawing and spelling, and questions, orienting questions. What year it is? What year is it? Who's the prime minister? Those sorts of things. And then finally, one of the assessment tools is the collateral information. Of course, collateral information is the information provided by family members about any changes that they may have noticed or witnessed in their family members' abilities. So this information can really help the physician. All of these pieces can help put, the information together so that the physician has a complete picture of the changes that are occurring. And finally, the purpose of the assessment is to assess the symptoms and eliminate other possible causes of those symptoms. Okay, so just looking at treatment, while there isn't currently a cure for the disease or medications that will stop the progression of the disease, there are several medications available that can help with some of those symptoms. So So the medications can help slow down the decline of memory, can help slow down decline of language and thinking abilities. One thing to note is that these medications work for about 2/3 of the people. So there are some individuals where the medication may not work because of other health conditions that they have, or possibly because of other medications that they may require, which are probably more important to sort of control those medical conditions that they have. And of course, these medications are effective for a limited amount of time. So these are some of the medications that are used to treat dementia, different types of dementia. In Nova Scotia, our healthcare system funds 3 cholinesterase inhibitors for people in early to mid stage of the disease. And so these medications, specifically donepezil, a lot of people are more familiar with the name Aricept, rivastigmine or Exelon, galantamine, Remenil. These medications are covered by the Nova Scotia Medicare for people 65 and older. So the medications are approved by Health Canada. And if you want more information around these, you can go to the Alzheimer's Society of Canada's website, or give us a call at the Alzheimer's Society. We have more information specific to each of these medications. So these medications can help with the symptoms of, as I said earlier, decline in memory, language, and thinking abilities and motor skills. So people who respond to the medication can experience improvements in their quality of life that may last for several months or possibly even years. So it's important to remember that people respond differently to treatments, and not everybody will respond to these medications. So memantine or Abixa has been approved for use in the mid to late stage of Alzheimer's disease. And so for Abixa, it's how it works is it works on brain receptors that may help with the transmission of nerve signals within the brain. So it helps the brain do its functioning. It can be used in combination with one of those previous medications. So it's not currently funded by Nova Scotia government. And so, of course, how these medications work, specifically people with Alzheimer's disease and other forms of dementia, they have a lower brain level of the neurotransmitter acetylcholine. And so acetylcholine is really important for many functions, including memory. And so these medications work by increasing that level of acetylcholine in the brain. So it improves the brain function. So the most common side effect with these medications, it could be stomach upset, vomiting, diarrhea, trouble sleeping. So again, if you have questions, about medications, it's always important to consult with your family physician, and of course to consult with your pharmacist. Very, very important. So in the following slide, we'll look at the stages of dementia. So in general, with Alzheimer's disease, and as far as the progression, at the Alzheimer's Society, we look at 3 global stages. So these can be different with the other types of dementia, but a lot of the same symptoms develop, perhaps in different orders. So the early stage, when we look at those 3 stages, the early stage refers to people of any age who have mild impairment due to symptoms of Alzheimer's disease. So common symptoms include forgetfulness, difficulty learning new things, and following conversations, difficulty concentrating, or they may have limited attention span. There may be some mood shifts, including apathy and depression, and possibly mild coordination problems. And then, of course, these symptoms, they might not stand out at first in the early stage. The person in the early stage of Alzheimer's disease may retain many of their functional capabilities, and assistance may not be needed or requested. However, problems may start to recur, like difficulty. They may begin to see changes at work, things that are different than they normally would be. Middle stage, so the middle stage brings a greater decline in the person's cognitive and functional abilities. This stage often seems the longest, and everyone involved will need help and support. So memory and other cognitive abilities will continue to change. The person may still have some awareness of their condition, And then, of course, the late stage of Alzheimer's disease may also be called the severe or advanced stage. And so in this stage, the person living with Alzheimer's disease will eventually become unable to communicate verbally or look after themselves. So we're looking at really 24-hour care at this point in the later stage of the disease. At this stage, it's really important for family members and caregivers to continue to support the person to ensure that their highest quality of life, to ensure that person's quality of life by providing supports and getting support for themselves as well, which is really key. So whatever staging system is used, or even if none is used, the disease affects each person differently. The order in which symptoms appear, the length of each stage, it really varies. And stages may overlap, so there's no real clear line where one begins and one ends. Not everyone will experience all the symptoms of a stage. So looking primarily at those three areas: early stage, middle stage, and late stage. The global deterioration scale, so some healthcare professionals use the global deterioration scale, also called the Riceberg scale, to measure the progression of Alzheimer's disease. And this scale really divides Alzheimer's into 7 different stages. And again, you can get more information from our website if you want to learn more about the global deterioration scale. And finally, we are going to look at some of the programs and services at the Alzheimer's Society. So we have a number of programs and services for people living with dementia and their care partners. So through the expansion of partnerships throughout the province, our hope is really to increase access to those programs and services. So the info line is a confidential telephone service provided by a team of knowledgeable and caring staff. So we provide information on topics related to Alzheimer's disease and other dementias. We can discuss questions and concerns and provide referral to programs and services with our partner organizations as well. You First for Care Partners. This is a 6-hour workshop, which is an innovative education program designed to increase care partners' confidence and capability to reduce responsive behaviors while enhancing the well-being of not just the care partner, but also the person who's experiencing the behavior change. And then, of course, we have support groups. And so these confidential groups are provided for caregivers, but also for people in the early stage of dementia as well. So they provide an opportunity to learn, to share, and to help each other through mutual understanding and support. And so these groups these meetings are facilitated once a month. And we also have a number of brochures, the final bullet there on the slide. So we have over 40 Alzheimer's Society of Canada fact sheets and brochures, which provide a variety of information related to different topics related to dementia. They're all evidence-based, research-based care practices, which are regularly updated. And with all of our programs at the Alzheimer's Society of Nova Scotia, they are provided at no cost to participants. So if you or someone you know wants to know more about Alzheimer's disease or other dementias and the resources to support persons with the disease, we would recommend that you call your local society. And we're just going to finish up with our final slide here. And we want to thank you. Thank you for joining us for session 1 in the 6-part Family Caregiver Education series brought to you by the Alzheimer's Society of Nova Scotia. If you'd like to learn more information about the information presented here or copies of the resources mentioned, please call your local society. It's never too early or never too late to connect with us. Please give us a call or send us an email if you have any questions at all or if you need to talk. If you're not in Nova Scotia, please feel free to connect with your local Alzheimer's Society.